Now we will see the adverse drug reaction monitoring. So, in the medication order review, this is part and parcel of medication order review. So, whenever you are reviewing patient's medication chart, you might be looking for the various problems, drug related problems which we have discussed in earlier module. It may be subtherapeutic dose or overdosage, or maybe an indication is there but the drug is not being prescribed, or there may be a failure of therapy, or any related drug related problems you can come across. So, apart from that, there is another drug related problem is this adverse drug reaction monitoring. So, what this WHO says, the definition of ADR is any response to a drug which is noxious and unintended and which occurs at doses normally. Please see this particular two keywords, the doses normally which are used in man for prophylaxis, diagnosis or therapy of disease or for modification of physiological function. So, whatever ADR means, it is not that the overdosage of any particular drug or any poisoning by any particular poisons, that is not an ADR. So, normally the students used to get confused. Any particular reaction happens with any particular drug is an ADR. So you will have to understand that it occurs at doses which are normally used. So, whatever your day to day any particular disease, if you are using any drug which is of a normal strength, normal dosage, whenever you use and you come across any particular ADR, and that is called as the adverse drug reaction. So, whenever you go for ward rounds, your the fundamental responsibility is to check for, talk to the patients and find out any adverse drug reaction is being happened on that particular patient for whatever the drugs being prescribed. So, whenever you come across any particular ADR, this is a major problem. So, worldwide this adverse drug reaction is a major problem for causing the mortality and morbidity, and the most of the hospital, that is at least 10 to 20% of the patients who are admitted in the hospital, they come across ADRs, and at least minimum 5 to 7% of the patients who are admitted in the hospital are due to adverse drug reaction. So, such is the importance of this particular adverse drug reaction. So, it is the responsibility of the clinical pharmacist to check whether the patient is showing any particular ADR towards whatever the drug is being prescribed. So, first of all, what are all the steps which are involved in monitoring this particular ADR? So, there are various steps like identification and monitoring, detection, assessment and management, and then documentation. So, whenever you come across any particular ADR, first of all you will have to identify that particular patient, whether there is any potential nature of causing any particular ADR because of the drug usage in that particular category. See, for example, the patients who are using polypharmacy, that is more number of drugs, more than 2 drugs, 3 drugs, 4 drugs, 5 drugs, if they use it for different conditions. So, any diabetic patient who is on with renal failure or with cardiac conditions or any other problems, or they might be using some more than 5 to 6 drugs. So, the patient who are on polypharmacy, geriatric patients and pediatric patients, and patients who are on narrow therapeutic index drugs, and patients who are on chronic disease conditions, and patients who are on anti-cancer drugs, psychiatric drugs. So, there are very many categories of patients you will have to always look in for probably it can cause some of the adverse drug reactions.